Hi, this is Dr. Brad Stephan with Stephan Surgical Arts. We are a Tampa-based aesthetic surgery practice, and we are here today to discuss breast augmentation. Now, there are four main types of incisions that are used for breast augmentation. The most common one is a perirealar incision that we use, and then the second most common one that we use is an inframammary incision, which is an incision right under the breast. The other two types of incisions are transaxillary, which is an incision placed over in the armpit, and then there's another one placed around the belly button. The reason why that we've chosen to use these two types of incisions, the perirealar and the inframammary incisions, is because they're the most safe and they provide the best aesthetic results. Now, there's multiple ways to place the implant after creating the incision. You can, in general, place the implant on top of the muscle or below the muscle. Both of these have their advantages and disadvantages, and really need to be tailored to each individual patient. Now, the types of implants that we use. We do use saline implants, but we use them very rarely. This is because in general, the silicone implants have a much more natural feel and much more natural look compared to the saline implants. Actually, when saline implants are placed, they actually have to be overfilled simply so they won't ripple, so you won't see rippling through the skin. And when they are overfilled, that creates a harder type of an implant. So the main types of implants that we use are the Allergan, Naturel, and Spire implants. There's three main types of them. One is responsive, the other one's soft, and the other one's cohesive. The responsive has a very low cohesivity compared to these other ones, which means that it's a little softer. This is great for the patient with a significant amount of breast tissue, and that will actually cover the implant. The most common implant that we use is a soft touch. This soft touch is a very nice between the responsive and the cohesive type of implants, and that's especially in regards to how just cohesive it is. This gives a beautiful aesthetic result, a decreased chance of any type of rippling compared to the responsive, but it's still very soft. Now, the cohesive type of Allergan, Naturel, Inspire implant that we use, we most commonly use this after we need to take out previously placed saline implants. Again, we do not place saline implants very often, so usually these are redos from outside facilities. So the most common reason for needing a redo with a saline implant is because you have rippling. And if you already have rippling, the patients really need to go with a cohesive style implant, and that's because it's at least likely to show any rippling later on. And these aspects, as well as many other aspects of breast augmentation, are discussed during consultations over here at Stephan Surgical Arts. If you're interested in this procedure, please give us a call. Thank you.